There's like a really simple way to think about what this bill would do. It's going to take $1 trillion out of government healthcare programs. So $1 trillion out of Medicaid and out of the Affordable Care Act, Obamacare. It's going to take $1 trillion. That's a lot of money. And because they do that, a lot of people are going to lose healthcare.
All right. He writes the breakdown newsletter for the Bulwark. It's new. You better be getting it. It is extremely valuable. It makes me smarter. He also has books which include The 10-Year War, Obamacare, and The Unfinished Crusade for Universal Coverage. It's my newish colleague, Jonathan Cohn. How you doing, man?
Hey, I'm just trying to keep up with everything and decide if I have to republish the book on the 10-year war as like the 18-year war, the 20-year war. I guess we'll see.
It shows the limits of creating names such as this. You know, the president has decided the Israel-Iran war is the 12-day war. We were just talking about that. Might turn out to be a little longer than 12 days. We'll see how it goes. And you and Trump have very little in common, but in this case, maybe you might be learning a lesson together.
Not that much in common. But hey, I'll take a lesson wherever I can get it. So there you go.
Do you have one of my favorite quiz questions to ask my MAGA family members is, or friends or whoever people I encounter, is what is a trait that Donald Trump has that you would want your child to emulate? You have 2 children. Can you answer that? Do you have anything? Do you have a single trait of Donald Trump's you wish your child would emulate?
Oh boy. A trait of Donald Trump that this is hard. I will say this. I think something he does well as a politician, which is probably a good thing in life, which is if he's intent on doing something, he doesn't let people dissuade him that easily. I mean, I think in the reality that we live in, I'd prefer people dissuade him from most of the things he wants to do. But that ability to kind of block out the noise and believe that you're doing the right thing and pursue it, I think is a valuable quality. And I frankly wish more leaders who I do like and agree with had that quality.
Self-confidence.
So there you go.
There you go. You can put up a little, something in the bathroom, in the guest bathroom. That's like a little affirmation about Donald Trump that your children can admire. I'm sure they'll be very excited to hear this clip. All right. You have a newsletter out this morning called The Big Beautiful Rush Job about the BBB. You write that the goal is to start the voting process this weekend and get a bill on Trump's desk by July 4th. That's 8 days from now. Not nearly enough time for Republican lawmakers to figure out exactly what's in the bill. Feels like we've been here before. And that was complicated kind of as you were publishing by this rule from the parliamentarian that says that some of these Medicaid cuts don't fit within the rules. I guess just talk about the difference between Obamacare and this, because Obamacare kind of had a reputation for getting rushed. We got to pass the bill to see what's in it or whatever the famous Pelosi quote was. Talk about like the comparison between that and the degree with which they're trying to jam this through.
Yeah, I mean, there's that famous Pelosi quote that always comes up in these discussions, and people are like, look, they secretly passed Obamacare, they crafted it behind closed doors, nobody knew who was in it, which could not be farther from the truth. They spent a year debating that bill. There were long committee hearings in five congressional committees, hundreds of hours of testimony, days and days of floor debate in sort of multiple stages. It was all sort of, on the front pages, debated for months. And for better or worse, a lot of the stuff that was said about the bill was wrong or was exaggerated, but there was a lot of discussion.
Did the death panels ever come?
No, although we may get some now. So, stay tuned from this Republican bill. But it was, for better or worse, the process took a long time. To the frustration, by the way, of the Obama White House. I mean, Rahm Emanuel was like tearing his hair out because it was taking so long to get this bill through. And there was like these long negotiations in the finance committee. So the quote that Pelosi gave that everyone used was basically, she was saying, look, there's been so much controversy, so much misinformation. When you're finally done with this bill, people will see that what we're actually doing doesn't match up. There are no death panels, to take that example. So that was, a year. And what are we doing here? So go back to Memorial Day weekend, the week before Memorial Day, when the House passed their version. They literally got language out they put the language of the final language of the bill because they were negotiating quietly what they were going to do, and they put it out on a Sunday night. And then I can't remember if it was Thursday or Friday they finally voted, but 5 days to, for a massive tax cut, huge cuts to healthcare, cuts to food assistance. By the way, ripping out a sort of generational investment in clean energy along the way just for kicks. And now we're over in the Senate, and they're doing the same thing. We don't have final language yet. Forget the Congressional Budget Office trying to do an assessment of it. And they're talking about they want to have a vote over the weekend. I mean, that is just bonkers. And of course, if you go that quickly, of course, the public's not going to understand what's in this bill. Of course, people aren't going to have time to analyze it. And, honestly, I'd be shocked if most of the senators and representatives voting on this really know in a kind of deep way what's in this bill.
So let's zoom out and then talk about like what is in the bill, and then we can kind of get into the parliamentarian and the wrangling.
So look, it's like super complicated bill by design. Like what they've done is on the certain terms, this in terms of what they're doing to healthcare, they've packaged all these, provisions, these targeted things that sound super complicated. Repeal the Medicaid eligibility rule and change. You don't need to know anything about that. There's like a really simple way to think about what this bill would do, which is it's going to take $1 trillion out of government healthcare programs. So $1 trillion out of Medicaid and out of the Affordable Care Act, Obamacare. It's going to take $1 trillion. That's a lot of money. People, you don't know your budget figures. Trust me, that's a big, big chunk of money in the federal budget. And because they do that, a lot of people are going to lose healthcare. There's an estimate from the Congressional Budget Office, 11 million people lose health insurance. On top of that, we have millions more who are going to have to pay more for healthcare, either because they're going to have to pay higher premiums in Obamacare, they'll have higher cost sharing, and this is going to hurt people. We can argue about any of the individual changes here. This is a good one. This is a bad one. This one won't be so bad. There's room for debate on all this stuff. But when you take that much healthcare away from that many people, they're going to suffer. They're going to have higher bills. We're talking about a lot of low-income people, working class people, some middle class people. They're going to have trouble paying their rent. They're going to have trouble paying their grocery bills, and they're not going to be able to go to the doctor. And some of them are going to just go into deeper financial distress, and some are going to get sick and die. Like a lot of reporters, I've been spending a lot of time interviewing people about this. Just this week, I was interviewing a woman from Pennsylvania. She's a home care worker, right? She cares for an elderly woman who can't get around. She cooks. She moves around. She moves her on the bed. She lifts her into a wheelchair. She makes $14 an hour. Okay, $14 an hour. She can't afford health insurance, so she relies on Medicaid. She also relies on food assistance. And by the way, Medicaid pays the agency for the care for the elderly that then pays her salary. You cut Medicaid and it affects her, she's going to feel it. She's in her 50s. She's got a shoulder thing from, all the lifting, right? She's got some cardiac problems. And, maybe she gets find a free clinic. She can get the basic care, but she can't get to the cardiologist. She can't get to the orthopedist. Best case scenario, she's in a lot more physical pain at her work. Worst case scenario, she can't work. Worst case scenario, she gets a heart attack, something awful, and she dies. And that kind of thing is going to happen. I mean, that is what we're talking about with this bill.
We were talking about this last night on the next level. Like, I don't really understand why they're doing it. I just don't. I don't. Can you make heads or tails of this? And I know you've just been like, I guess let's put it this way. There are the people on the Hill. The congressional guys will have their own self identity. Maybe they just think government should be smaller, so they're for any cuts, or maybe they feel guilty about how bad this is going to bust the debt, so they feel like they got to do something to save face. Like, that's all kind of psychological analysis. Like, the analysts, like, you read like the conservative analysts. Like, what is the defense? I can't even find like a compelling defense of doing it the way they're doing it. What have you seen anything?
Yeah, there is. So, I mean, I want to acknowledge, like, there is a principled conservative argument, right? And I actually, I really respect people come out and make these arguments. I think it's important to argue these things in American politics now. And they would say, putting these programs in general aren't that efficient. We could spend our money better. we should have a smaller government. We need lower taxes. It's better for the economy. And they think, maybe there are trade-offs. Maybe some people lose healthcare. It's worth it in the end. I mean, I don't believe that, but that's an argument we can have and we should have, and that's why we have two parties, right, to make these arguments. In addition to that, there is a more detailed analytic argument that's been put forward. There are some think tanks out there that have been making these arguments that basically say, look, there's a lot of fraud. There's a lot of people on these programs who don't deserve to be on these programs. They don't really satisfy the eligibility. And there's waste and abuse, and that these changes in this bill are going to cut down on that. They're going to get rid of their people. It will get rid of the people on Medicaid or on Obamacare who don't really qualify but are getting in because they've managed to deceive somebody. Yeah. And then there's a separate argument about the work requirements is a sort of second set of arguments, which is that we want to make people. We think we should condition health benefits on work, and the work requirements will do that. And those are sort of the two big arguments. I mean, there's others, but I'd say those are the two big ones.
Go back to, I'm trying to think of another unpopular thing that I was for on the conservative side, the Social Security privatization plan. How about this? The Social Security privatization plan had a lot of, very serious think tank folks who were excited about it and made the case about why this would be better for the budget long term and why it'd be better for people. There are a lot of people on the Hill though. That is not really the case here. You really have to kind of dig through for people. Do you feel that way, or am I just missing it? Is it somewhere outside of my bubble? I don't see anybody that's super excited about this. There are people that are really excited about the fantasy that it's only waste, fraud, and abuse. That's what I keep seeing, is the defense of it. It's, we're just getting rid of the waste, fraud, and abuse. But that's not true. So what about a defense on the merits of the actual program?
Yeah. Well, you're picking up on, I think you're picking, I think you're mostly right and picking up on something real here, which I think speaks to the way this debate has evolved, which is you kind of go back 20 years, 25 years in the healthcare debate, Republicans versus Democrats. You had a lot of really heavy hitter kind of economists and analysts, people at places like American Enterprise Institute, who they would advise, like John McCain when he ran for president, for example. There's a very formidable conservative healthcare economists on that side of the aisle. The thing was, those conservative economists, a lot of them, I think of one woman in particular, her name was Gail Walensky. She just passed away a year ago. Really brilliant woman. She actually ran Medicare and Medicaid under Bush 1. So under Bush, wait, I get my numbers. Is that 41? He was 41. I was 41. Yeah. Okay. So Bush 41. And, really formidable. The thing was, she didn't hate, she wasn't totally against government healthcare, and she was, government playing a role in healthcare. She didn't want to screw the uninsured, right? I mean, she thought we should do something to cover people. She just had a kind of more conservative spin on it. And I remember when they got to the Affordable Care Act debate, I mean, I remember interviewing her at the time. She's like, yeah, I think it's too much government regulation spending, but okay, put me in a room with a liberal economist. I bet we could figure something out. Well, no space for that in the Republican Party of Donald Trump and MAGA. They just want nothing to do with this stuff. And so most of the really sort of serious, who would have been serious conservative intellectuals on this 10, 20 years ago, they're not in the Republican Party anymore. They're not welcome in the Republican Party. They're either on an island by themselves, or a lot of them have started advising Democrats. Now, there are, I know this all sounds vaguely familiar, but there are exceptions. There's this one think tank called Paragon Institute, which is run by a guy who was a top healthcare advisor to the first in the first Trump White House, Brian Blaze. Very serious guy, knows what he's talking about. As much as any person or think tank, they've been sort of responsible for putting out the material on this. So he's there. There's a handful of other people you can find in some of these groups, but for the most part, the really serious people aren't part of the Republican universe anymore.
All right. Congrats, Brian Blaze, PhD. I'm just checking him out. Nice haircut. So just on the primary and secondary effects, and you mentioned the anecdote of the woman, what exactly are the programs and the impacts, that people are going to feel?
Yeah. So, I mean, the biggest cuts in this bill are to Medicaid and the Affordable Care Act, Obamacare. And there's sort of two kind of sets of really big. So one is a kind of whole, there's a lot of new rules for and new procedures for what you need to do to sort of qualify and stay eligible for these programs, right? So
more paperwork, which is
more
great, which is a
paperwork.
very conservative,
yeah. Right. I mean,
anti-abundance.
It really is. I mean, but that's sort of the point here is that, the sort of the theory of we have all this waste, we have all this fraud, we need to really carefully screen every single person and make them file their income every month. And look, any large program, there's people who aren't eligible for various reasons. And certainly there's a good, smart way to avoid that. But what they've done here is basically say, we're just going to, throw up a lot more paperwork. And we know what happens because we've tried this before. And it's obvious if you've ever had to deal with a government agency, you know how this works. It's just so easy for errors to come up. The agencies are underfunded, so they can't deal with problems as they come up. And think of who you're dealing with here, right? You're dealing with a sort of population. It's probably a lot of people, seasonal workers. They have trouble getting documentation to show that they're working. You have a lot of people, maybe they don't have great access to technology. They don't know how to use technology, especially as you get to older cohorts. The polite word in the policy world is friction. We put friction in the process of getting on these programs.
It's really what we want. We want to make it as hard as possible for people to get healthcare. That's great. More friction in the process. Yeah, got it.
Literally, that's what we're doing here. And then there's like straight up cuts. I mean, this doesn't get enough attention because we've all been, to the extent that people are paying attention, we talk about the work requirements or whatever. They're actually like just straight up cuts, especially when you get, you see it really in the Affordable Care Act part, where they're sort of changing the way that the sort of the standards for what insurance has to cover or how much assistance you can get through a tax credit. The formula is tweaked. Again, it's one of these things that if you look at it, you have no idea. But, it's going to mean if you're, you're a kind of working class, you buy coverage through healthcare.gov. And, right now with your tax credit, you're spending $200 a month or something on your insurance. Well, now you're going to go ahead and to get that same insurance, you'd have to pay more. Or you can keep paying the $200, but suddenly you're going to discover that like your copay at the pharmacy is like double what it was.
Yeah.
And, you sort of pay that. So that's kind of the primary effect.
And also the other thing you said, the way the formula is working, they're also changing the formulas for the states in a big way. And that is like why you see a lot of like the rural hospitals like freaking out. Because like that is another, I think, real like tangible impact potentially that folks are going to feel. Because if there's different formula going to these like states and the states are getting less money, well, that's going to come out of something.
Yeah, and the rural hospital pieces, I mean, there's a reason we keep hearing about it in the news. It's, rural hospitals, just the finances of rural hospitals. It's really tough. It's tough to make money as a rural hospital. They've really become dependent on Medicaid. Depending on how these cuts go through, a lot of them are going to struggle. We've already had rural hospitals closing. You're going to see more rural hospitals closing. And I think this is so important because it shows how, even if you're not on Medicaid, even if you have like good employer insurance, how this can affect you. So imagine you live in rural Nebraska or Louisiana or Michigan, where I live, right? So your Upper Peninsula, Michigan will do my state. Your Upper Peninsula is the winter and, you're pregnant 3 weeks early, you're in labor and it's the snowstorm. And now the hospital that was there isn't there anymore. They don't do maternity services, let's say, or whatever. So you can have the best insurance. You can be very well off. You can never touch Medicaid or Obamacare. Doesn't matter. You still got to drive in a blinding snowstorm, 60, 70, 80 miles, which, is probably not what you want to be doing when you're in labor, or especially if, hopefully not, but, you're in some kind of distress. So this affects everybody, even people who aren't dependent on these programs.
Like where our minds go to these totally opposite places. You're in the Upper Peninsula. It's a snowstorm. I'm thinking that like you're down in the bayou and there's like rain, and it's like you gotta try to get up to Homa. You're down there in Meadow. Anyway, yeah, it's that's ugly. All right, so the news this morning was essentially, how do I explain this in a way that takes out as much jargon as possible? Like, in order to pass this thing with only 50 votes, because there are only 53 Republican senators, you can't have the 60, you can't overcome the filibuster. You can do that through the system called reconciliation. Most of the big budget and tax bills that have been passed, like in my adult life, have come through reconciliation. And reconciliation comes with certain rules about like what can be included in it and what can't. And there are also some rules on how much can add to the deficit, though those are a little bit more. Those are a little bit easier to get around. So there's a parliamentarian in the Senate that kind of looks at it and is like, well, this can fit in reconciliation, this can't. And there's some news this morning that the parliamentarian essentially said that a big part of these Medicaid changes cannot be included in the bill, which means that the Republicans are either going to have to say, fuck you, parliamentarian, and vote to overrule them, or some of these cuts won't be included in the bill, which maybe creates political problems. Is that a good assessment?
That was a really good explanation. Okay, better than probably what I would have come up with. But yeah, I mean, basically.
So what are the parts that are then now going to be debated over? As far as you can tell.
So there was a piece last night, a big piece that got cut out, which was. I'm not even going to try to explain this one. This one revolved I literally, when I wrote about this, I had to put it, I just finally gave up and I put it in a footnote because it was so complicated. And the footnote was I think broke the record for longest footnote in the history of Bulwark footnotes.
All the good stuff is in the footnotes on the Bulwark. Just a little
read the footnotes. Yeah. But they're called, I'll just say it has something to do with something called cost sharing reductions. And if you really care about it, just Google it and parliamentarian, you can read all about it. But it knocked out about 150. Well, I don't know the exact number because they don't, as always, these things, they don't say this thing is out and this is how many dollars you lose because it's not always clear it's 1-to-1, but it could be like $100 billion, maybe more. And then this morning, there was a whole list of pieces they knocked out. The single biggest one of which was a change to something called provider taxes, which is the thing you were referring to a little while ago, which has to do with how states get money from the federal government and a sort of budget gimmick they've traditionally used to get a little more. You put those two together, at least I spoke to some budget analysts this morning as this was breaking, and their feeling was you kind of put those two together, you're looking at somewhere between $250 to $400 billion in cuts that just got taken off the table. Now, again, what do? Do they just overrule the parliamentarian? I think Trump just 5 minutes ago we're really, 5 minutes before I got on, I think said can you believe the parliamentarian? It's the deep state, whatever. I think Thune, who's the, majority leader in the Senate, has already said we don't want to overrule the parliamentarian, although they did it once already for something unrelated a couple of weeks ago with the California environment, overriding a California rule on emissions in cars for pollution. So they could overrule it. They could not overrule it and try to reword. It's a lawyerly thing. So you can try sometimes to restructure, reword the provision so that it can get the okay. They can look for other cuts or, here, I'm just going to throw this out there as a wild idea. They could just not cut Medicaid as much. I mean, that's possible.
Well, that'll be something to watch. Yeah. And so of the total amount of cuts, it's what, 33, a third? Essentially.
I mean, it's a lot, right? I mean, we're talking $1 trillion in total cuts to healthcare, roughly. Yeah. So if you're, you're somewhere between 25% and 40%, maybe. And again, we'll see. It always takes a few hours for everyone to figure out the numbers, but at least based on what we last heard, yeah.
All right, we'll keep monitoring it. If they just kind of jam this thing out over the weekend, we will keep everybody posted. But it's one of these things where it is and your newsletter kind of framed it like this about how TV news has not covered this as much, given the real impact it's going to have on people as compared to, some of the other things in the craziness of our political world right now. And part of it is just because of this, this stuff is very complicated, right? It's complicated to do, but of all of the stuff that Trump is doing, it might be the thing that ends up affecting people's lives the most directly. So we're going to keep working on it. Jonathan's covering it. Read his newsletter, and we'll be talking to you soon.